But as always, right at the top, let's tell you first the All India picture on coronavirus as it stands this evening. 3,851 are now the total number of active cases in the country at the moment. Deaths are 111, and the worst hit states are Maharashtra at the moment, where active cases are 647. Deaths are 45 in Tamil Nadu. Active cases are 558 here. Deaths 5 in Delhi, where active cases are 497. Deaths are 7. So Tamil Nadu, Maharashtra and Delhi have cornered almost half the number of cases across the country at the moment which have seen coronavirus positive cases. Okay, we're going to be joined today by Dr. Arvind Kumar. He's Director, Institute of Robotic Surgery at Sir Gangaram Hospital. Dr. Gautam Bansali is from Bombay Hospital. He's heading the team on COVID action force that has been set up in Mumbai. He's the coordinator there. Professor Prabhat Jha is Distinguished University Professor of Global Health, University of Toronto. The question that we are going to raise with them is very simple. With over 690 cases reported in India in the last 24 hours, we seem to be now entering a crucial week. A week where India will decide whether it goes the way of South Korea, which registered a sharp drop in cases after a particular critical period, or will we go the way of Spain, where the number of cases doubled after 10 deaths every day? The question now also is whether we are slowly but surely, as a section of the government indicates, entering community spread, or is it still localized? That's the question that has divided the medical community, and that's the question we're going to raise tonight. Take a look at our top story.
तमाम देश एकजुट होकर कोरोना का मुकाबला करे, इसके लिए सार्क देशों की विशेष बैठक हो या G20 देशों का विशेष सम्मेलन, भारत ने इन सारे आयोजनों में बहुत महत्वपूर्ण भूमिका निभाई है। इस दौरान दुनिया के अनेक देशों के राष्ट्राध्यक्षों से भारत लगातार संपर्क में है, मेरी भी बातचीत होती रहती है। सभी ने भारत के प्रयासों की सराहना की है।
But this is no time to celebrate. It is now more than ever that India needs to up its game. Data suggests that COVID-19 cases have started doubling every 4 days in Delhi and Mumbai. The director of All India Institute of Medical Sciences has warned of coronavirus community transmission in some parts of the country.
मेरा नाम दोनों स्टेजेस के बीच में है। ज़्यादातर भारत में अभी भी हम स्टेज 2 में हैं, जहाँ कम्युनिटी स्प्रेड नहीं हुआ है। कुछ एरियाज हैं जो हम हॉटस्पॉट्स कहते हैं, जहाँ पे कुछ हद तक लोकलाइज्ड कम्युनिटी स्प्रेड है, और उसको अगर हम कंटेन कर पाएँ और आगे और जगह ना फैलने दें, तो हम स्टेज 2 में ही ज़्यादातर रहेंगे।
Stage 2 is the known chain of transmission, while Stage 3 is the unknown chain of transmission, when infections happen in public and a source for the virus cannot be traced. As India battles its worst health emergency, the government maintains that it is on the same page with the AIIMS chief.
एम्स डायरेक्टर साहब ने जो कहा है वो उससे लिंक्ड है। जैसे आप हमारे से हमेशा क्वेश्चन पूछते हैं कि क्या देश में कम्युनिटी ट्रांसमिशन है, और हम हर बार आपसे रिक्वेस्ट करते हैं कि अगर ऐसा होगा तो हम आपको खुद आके बताएंगे, बिकॉज हम चाहते हैं कि देश अलर्ट हो जाए। इतने बड़े देश में अगर किसी पर्टिकुलर पॉकेट में ज़्यादा केसेस पाए जाते हैं तो उसको कंटेनमेंट की हमारी क्लियरली डिफाइंड स्ट्रैटेजीज हैं और उसके तहत ही हम काम कर रहे हैं।
Meanwhile, the top scientist in Prime Minister's COVID-19 task force and ICMR chief has assured that testing is sure to increase.
तो करंट कैपेसिटी जो हम बार बार बोल रहे थे 13,000 की, वो अगर हम 2 शिफ्ट्स में करना शुरू करें तो आराम से वो 25,000 के ऊपर जाएगी। हमने सारे रिसोर्सेज इस्तेमाल किए, तो मैं अभी बोलूँगा नहीं, वो संख्या काफ़ी इतनी बढ़ जाएगी कि आपको टेस्टिंग के बारे में सोचने का कोई डर नहीं रहेगा कि हम क्या टेस्टिंग कर सकेंगे या नहीं।
There is a fear that the low rates of testing leads to an information gap that increases the risk of spread of SARS-CoV-2 in tightly packed communities. Bureau Report, India Today.
Let me, before we come to our guests, also put up a graphic for you, because this graphic in a sense will offer a key to where India goes. Do we go the South Korea way, where you can see that there was a clear plateauing of the number of deaths in terms of how quickly South Korea got the situation under control? India, deaths are doubling every 4 days, but in Spain, they were doubling every 2. So do we go the Spain way, or do we go the South Korea way? That's the question I want to raise to my guests joining us at the moment. Dr. Gautam Bhansali, as I said, head of the Task Force Committee on Coronavirus and General Medicine in Mumbai. I want to put to you that question, sir. That we now seem to be at a critical point in this country. The deaths have come to 111. Most countries either find that there is, after a particular point, a certain plateauing, or as in Spain and Italy, you have a doubling. Which way do you see India going, given the fact that at the moment the government is still insisting we are not in stage 3?
Yes, Rajdeep. First, I will explain you that we are still in stage 2, we are not in stage 3. See, there is a difference between the stage 2 and 3. Stage 2 is a local transmission, where we know the source, where it comes from. Stage 3 is in the community, where we don't know the source. So as of now, how many cases we have find out that we know the source. That's why we are still in stage 2. Or you can say practically we are in between stage 2 and 3.
No, what do you mean by in between? No, Dr. Bhansali, let's be very clear. Dr. Bhansali, what do you mean that we are between stage 2 and stage 3? Are you saying that there is an element of community transmission, for example, in Mumbai, in areas like Koliwada, which has reported 8 deaths? Are we to understand this is localized community transmission?
Yeah, still we are in a localized transmission. It's a stage 2 because we know the source of infection. We know the source of contact. When we come to know that we don't know the source of contact, then we say that we are in a community spread or stage 3. So practically still we are in stage 2 only, not yet we have reached to stage 3.
So there is no case, Dr.
number has increased.
There is no case, Dr. Bhansali, anywhere in India which gives you a sense that we are in stage 3. Am I correct? There is no such case anywhere in the country where you cannot track the source of the infection.
Yeah.
Am I correct?
Yes, yes. Till now, whatever cases, how many cases? Yes, you are right.
Okay.
So till now, cases we found out that all cases have the source. They all have the source of contact. We didn't find any case which doesn't have any source of contact. Yeah.
Okay. There's no case in the country where we do not know the source of contact. I take your point. Dr. Arvind Kumar, you're Director, Institute of Robotic Surgery at the Sir Gangaram Hospital. I want to ask you, Dr. Arvind Kumar, do you also share Dr. Bhansali's view that we are still only in localized community, therefore there will be no exponential growth as some have feared?
Rajdeep, thank you very much for having me on this show. Dr. Gautam Bhansali is the head of task force, and he has access to nationwide data of possibly each and every case that is being reported from any part of the country. So therefore, once he has already said that we are in stage 2, I think I would refrain from, entering into this controversy of stage 2 or 3. But I would at the same time say, if we take it at the pan-national level, and if you call something which happened in Italy and Spain and is now happening in USA, that as stage 3, definitely on a country-wide level, we have not yet reached stage 3. But if you take a certain pockets, for example, Ramganj in Jaipur, and there are similar pockets in various states in the country, about 60 of them, where it has spread within the community, and also the fact that there could be a few hundred people who attended the Nizamuddin function who may still be hidden in various parts of the country, I as a doctor would overreact and presume that my country is heading towards stage 3. I would not enter into this controversy of 2 or 3. I would presume it as 3 and make my preparations that, okay, even if we are in stage 3, instead of this theoretical discussion of countrywide 3 versus countrywide 2 with pockets of 3, I think more important is what is the strategy at the moment. And I think the strategy of Government of India is very clear. And I must state that we are the first country in the world which took the historic and bold decision of applying a country-wide lockdown at one of the earliest stages in the development of this pandemic anywhere in the country.
Right.
Even China applied it much later, Europe applied it much later, and very ineffectively, whereas we have applied it much early and much more effectively. And I think but for the Marcus incidents, by now, most of us were expecting that somewhere between 5th and 10th of April, we would start seeing the benefits of this lockdown. As a doctor, there is no reason why 130 crore people sitting inside their houses should not be able to slow down the progress of this infection. It does not stand to reason that if 130 crore people are inside the house, the infection rate will slow down. It's the Marcus incident which temporarily has come as a setback. And I think if we just give about a week's time for the effect of this isolated incident to taper off or to cool off, we would again start seeing the benefits of this historic step which government has taken. So I would insist that lockdown, this social distancing is the key.
Let me stop you, doctor.
And face cover is the key. 3 steps.
Let me stop you because I want to, in a sense, look at other trends and patterns. Professor Prabhat Jha, if you look at India, many of the cases are concentrated around 62 districts. Now, this is in a country of more than 700 districts. 62 districts, less than a tenth of the total number of districts, are essentially accounting for most of the cases. If I look at the eastern part of the country, less than 5% of the total cases are accounted for in the eastern part. 43% plus cases are accounted for in southern India. And then you have Mumbai, which accounts for a total number of 469 of the 781 cases in Maharashtra. Now you have Delhi with a large number of cases. Are we seeing, therefore, as the government is insisting, localized spread of coronavirus? To that extent, there is hope that we could go the South Korea way and not the Spain way.
I think the definition of stages is in fact not at all helpful, and in fact distracts from the core strategies which is needed, is how to prevent new infections and to prevent the most vulnerable, the elderly and those in healthcare facilities, from being infected. It is obvious to those that are observing that there's already community transmission in India. If you look at the doubling time of deaths, which is a bit more reliable because it's not subject to the low levels of testing that are in India, deaths are doubling every 2 days. That's the current patterns.
Every 4 days, sir.
Every 2 days. Now, if you look at the latest numbers, it was 118 as of 2 days ago, and it was just 49 2 days earlier on April the 1st. So now that's the trajectory that you expect when the growth is occurring. Even in China, early on, they had community transmission occurring very early on in the epidemic. So what we should be concerned about is not whether India is in stage 2 or 3, but definitely what are the steps that need to be done. Now, there's 2 very simple things that need to be done. If you want the trajectory of South Korea, then you'll have to test like South Korea. South Korea's testing rates are about 80 per lakh. In India, it's less than 1 per lakh. Now, take a country like Iceland. Iceland has done exemplary testing. It tests about 600 people per lakh. And that has also shown an important feature, which is many people infected, particularly the younger, are not without symptoms. They basically don't have any symptoms. I mean, I could have infection and not even show any signs. Now, that's important because this idea of stages makes really very little sense if you take into account that many people already might be infected. Now, the question is, how do you protect the catastrophe that everyone wants to avoid? And there we know the lessons from South Korea, which was expansive testing and isolation. And then the other key part, which we're unfortunately seeing from the Italian scenario and the New York scenario, is that if you don't protect the facilities and make sure that every healthcare worker has full World Health Organization assured protective personal equipment, and that you're not doing testing of the healthcare workers, the places in India that could really explode would be the facilities. So this is what we really need to think about as a strategy, is not whether we're in stages, but how do we keep the number of people infected low?
Right.
And in most cases, they won't have many symptoms. It's not a killer disease in everyone.
So you're saying the two vulnerable groups to look at the moment are health workers, and you're saying rather than look at stages, look at how you can widen the ambit of testing to ensure that it hasn't spread beyond these 62 districts that we are at the moment focusing on. You know, let me for a moment just turn to you, Dr. Bhansali, because Mumbai itself, you know, where you are heading this COVID task force, coordinating it, what are the patterns that are clearly being detected? It appears that there are localized community spreads. I mentioned Kolivada, and there are fears that this could also spread to certain other areas. Do you believe that overall Mumbai is only showing a pattern where the source of infection is being tracked from outside, that there is no community, I repeat, there is no community spread in Mumbai, given the fact that Mumbai has registered 469 cases and the numbers have steadily gone up in the last week?
Yeah, Rajdeep, if you see the demography of the Mumbai, it's a densely populated city. And again, I am telling you, this is definitely locally transmitted cases. We have locked the community, we have locked that society, and completely quarantined the area, which is, even if the single positive case is there, we have locked out that complete area. We have quarantined that people.
No, I take that, sir, but Dr. Bhansali, only today, sorry to intervene, only today, a couple of hours ago, we have learned that a T-boy near Matoshri, near the Thakre residence, has tested corona positive. Now, do we know whether this is again localized community?
Yes. Yes, definitely. He must be localized community only, because he must be staying some area and from where they has got the infection. So it's a localized only. I still don't believe that it's a community spread. It's because source is still we can come to know, and this is localized only. It's not, you can say that stage 3 or community spread.
Okay, so you are saying Mumbai is firmly localized. In Delhi, on the other hand, Dr. Arvind Kumar, most of the cases are linked to the Tablighi. If the Tablighi crisis had not happened, Delhi would not see the kind of exponential growth. But as is being suggested by Professor Jha, the worry is that there are many parts of the country which are dark areas. We don't know whether the migrant workers, for example, have been fully tested. Our testing levels still remain way below international standards. So the question is, can we with any conviction say which way we are going until we test much more?
So I 100% agree that we need to test more, and that's why I think the ICMR has revised its strategy, and from RT-PCR only testing which was being done till now, we are about to move to the spot test or the antibody-based testing, for which I learned today afternoon from the press conference that nearly 5 lakh kits have been ordered, of which about 2.5 lakhs are expected by 8th of April. And I think Tamil Nadu state has ordered 1 lakh and Delhi has state. So once we get these kits which are on the spot at the point of clinical care test, I agree, and I would agree with the observation of one of the third speaker, that a panelist, that healthcare facilities should be the main focus. You see, look at what has happened in the Wockhardt Hospital in Mumbai, Jaslok Hospital in Mumbai. There is one hospital in West Delhi which had a patient who was detected much later, and a large population of that hospital, the healthcare workers were affected, and I think 4 or 5 of them are positive. So if in our Gangaram also there were 2 unknown patients who were later tested positive, and about 110 people are on quarantine. So if we start having the people at the forefront of this battle being affected, in dozens, they start going in quarantine or they go on the treatment. Suddenly, the number of people available in the hospitals will go down and they will further add to the load of patients. So there will be a double loss. And I think I would 100% agree that we should relax the criteria for testing for the healthcare professionals. Right. A large number of testing of the people at the front line should be done so that they don't fall sick, and by chance if they are involved, they are detected and removed from the system so that don't infect more patients.
Let me get you, Professor Jha, as I said where I started off earlier with you, are we seeing a pattern, and we are seeing some of it in the US, where certain states are more vulnerable, certain regions are more vulnerable than others? To that extent, do you believe a hotspot strategy that is focusing on these particular areas which are most vulnerable is perhaps the way forward even for India, given the fact, as I said, that a majority of the cases are concentrated around certain areas at the moment?
You can use a hotspot strategy if you've got really widespread testing. And I think just to spend a bit of time on what's needed for testing, don't test in healthcare facilities. Test away from healthcare facilities, like was done in Korea. The last thing you want is infected people to show up in a crowded OPD room of a hospital.
Right.
In the hospital, you have to absolutely separate out possible COVID cases from all of the other uninfected areas. This is what was done in China. And give every healthcare worker full PPE. Now, if those things were in place, and as the gentleman pointed out, testing was expanding, India might have a path to look like South Korea.
Right.
But what it needs is a wholesale different approach. Right now, the test costs 5,000 rupees for people to pay. How many people can actually afford to pay that? Testing needs to be free, needs to be widespread, needs to be set up as easy as going to a cash point to get money out of the bank. That's what Korea did. And if India wants to copy that, that's what it'll have to do.
Very, very interesting insights from you there, Professor, as well as all my other guests. Clearly, there is a long way to go. We need to expand testing and ensure that it is done in a cheap, cost-effective manner and as widespread as possible before we can take a call on which way India is going. Thank you all very much for joining me at the very top of the news today.
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel, and don't forget to press the bell icon to stay updated.